Hello everyone. So today we are going to talk about the staging of carcinoma oral cavity. So I'll try to make it as simple as possible for you. So first we'll discuss about the T staging. So TX is like in any other case, it means primary tumor cannot be assessed. And TIS is carcinoma in situ. So these are two things which are not very important to be remembered. Now T1, T2, T3. These three are the ones which are confusing because we have to take care of the size also and depth of invasion also. T4 becomes a bit easy because we know that T4 is the most advanced one, so it is not very difficult to remember. So let's see these one by one. So let's see the size. Size can be less than or equal to 2 centimeter, or it can be more than 2 centimeter but less than or equal to 4 centimeter, which makes it 2 to 4 centimeter, and it can be more than 4 centimeter. Less than or equal to 2 centimeter makes it T1. More than 2 centimeter but less than or equal to 4 centimeter makes it T2. And more than 4 centimeter makes it T3. More than 4 centimeter alone makes it T3. But now let's see depth of invasion. So depth of invasion less than 5 mm, less than or equal to 5 mm, or more than 5 mm but less than or equal to 10 mm makes it T2, and more than 10 mm. Now the more than 10 mm is a bit complicated. We'll get back to it later. But suppose there's a tumor which is less than or equal to 2 centimeter and the depth of invasion should be less than or equal to 5 mm. So that makes it T1. Now, if a tumor is has a depth of invasion of more than equal to 5 mm but less than equal to 10 mm, or it is more than 2 centimeter or less than or equal to 4 centimeter, that makes it T2. So either of the two can be counted as T2. Suppose there's a tumor of 1 centimeter. It is less than equal to 2 centimeter, so that should make it T1. But the depth of invasion is 7 mm. So this will make it T2. So even if the lesion is 1 centimeter, but the depth of invasion is 7 mm, then the staging will become T2. Now T3 is also clear. It should be more than 4 centimeter or more than 10 mm depth of invasion. So that makes it T3. But now for T4, we have two, T4A and T4B. So T4B may, like in any head and neck cancer, T4B is supposed to be skull base invasion. So we need to see it this way. It is very advanced cancer. So all the things which have to be involved in the cancer to call it T4B, these are masticator space, pterygoid plates, or skull base. And the most important, ICA, internal carotid artery. So if the tumor involves the masticator space, pterygoid plates, skull base, or internal carotid artery encasement, then that makes it T4B. So let's remember it with a mnemonic, SIMP. T4B is SIMP. Skull base, ICA, masticator space, and pterygoid plates. Okay. Now in T4A, what comes? So we saw that in T3, we have either more than 4 centimeter or more than 10 mm depth of invasion. But in T4A, what we have is the tumor is to be more than 4 centimeter with more than equal to 10 mm depth of invasion, more than 10 mm depth of invasion. So either this should be the case or the tumor invades adjacent structures like cortical bone of mandible or maxilla, extends to the maxillary sinus or skin of the face. Okay, so if the tumor involves the skin, maxilla, or mandible, so all the nearby structures, then it is T4A. And if it involves SIMP, then it is T4B. So I hope that makes the T staging clear. So let's just revise it once again. So keep revising with me. We have T1, T2, T3, T4A, B. So T1 is less than 2 centimeter, less than or equal to 2 centimeter with depth of invasion less than 5 mm, less than equal to 5 mm. T2 is more than 2 centimeter but less than equal to 4 centimeter with depth of invasion more than 5 mm but less than 10 mm, less than or equal to 10 mm. T3 is more than 4 centimeter or more than 10 mm. And T4A is more than 4 centimeter plus more than 10 mm DOI or involvement of the nearby structures which are skin of face, maxilla, mandible, cortical bone and maxillary sinus. And B is SIMP. SIMP is skull base, I is ICA encasement, M is masticator space and P is pterygoid plates. Okay, so this was the T staging.